Welcome to the Nobody Told Me That podcast. My name is Teresa Duncan, and my goal is to share information that you probably weren't thinking about. I love preparing my friends for situations that may come completely out of the blue. I also want to share with you many of the tidbits I picked up over the years. If you absolutely have to tune out before the end of the show, make sure to check out the show notes for more details on today's topics and information about my online class, Dental Insurance Design and Management. And thank you so much for making me a part of your day. I'd like to give a shout out to my friends at Synergy Dental Partners for sponsoring our podcast. They know how important the admin team is to our industry. Synergy is a group purchasing organization, or GPO. GPOs reduce your overhead with lower supply costs. They also have partnerships with labs and various service providers. You owe it to your revenue cycle to check them out. They're giving Nobody Told Me That listeners a 2-month free trial and a $200 Darby credit for new Darby customers. For more information, check out the link in the show notes or go to odysseymgmt.com/synergy. We are back here with my friend India Chan. She's a 2-timer now on my podcast. How are you doing?
I am good. Thank you so much for having me. I'm excited. I feel like a veteran now.
Yeah, well, you are. And so for those of you who haven't heard India's first podcast episode, we went into all sorts of HIPAA and OSHA and infection control. It was really the infection control that I was like giving her. I had so many questions for you.
Yes.
So you are the founder and owner of Learn to Prevent, which is an organization. It's a company that educates on all of the topics I just mentioned, but also you're rolling out some really cool online information too. And so we'll dip into that. But what's been keeping you busy since I last talked to you? Infection control, HIPAA, OSHA, both, everything?
I would say everything, Teresa. I mean, it's really been everything. I think one of the silver linings of COVID was that, dental practices and dental healthcare providers really started to take a look at their compliance programs. They really wanted to, ensure that they had a robust program, but also they wanted credible information. That's one of the things that I've found that a lot of dental practices now and dental settings, period, are wanting that credible information. They want to do the right thing. They're trying to make sure that they're implementing all of the protocols. And so that's really been keeping me busy. Not to mention, I do a lot of speaking nationally. So that's been pretty busy as well.
Well, it's been fun watching you go kind of all over the country. You've been pretty busy. Let's go back to this whole thing about credible, though. Where are people getting their information that makes them think, okay, this doesn't sound right, and so they need credible? Like, where are they going for the incredible information?
Gotcha. Well, they think it's incredible. They think it's amazing that where they get some of this information. I would say social media has been the place where people go the most if their practice or their dental setting does not have their own compliance consultant or maybe even like an OSHA officer or an infection control coordinator. Most people are going into groups. A lot of dental healthcare providers are in Facebook groups. They're following profiles on Instagram, and now the biggie is TikTok. So there's a lot of education happening around infection control for dental settings on TikTok, which I will just leave it there. Okay. I won't comment on that.
I can't do TikTok. Every time I think I can do it, I really look at it and I go, this is just not my people. Rather than try to put, square peg in a round hole, it just would not be a good fit. And I think my son would remind me of that, every time I made a video. He'd be like, so embarrassing, Mom.
Yeah.
But some people are really, really good at it. And I mean, I have a sense of humor and so do you, but gosh, you have to really be creative and thoughtful about a whole bunch of stuff. And I just don't have that kind of energy and drive, I guess. So.
Yeah, no, I'm right there with you. I think TikTok is for a certain type of user that, just has all that energy, is full of energy
Yes.
and can do that. But I just don't have the energy to do that. So
Yeah.
sometimes I've gone on TikTok just to kind of see what's happening in the dental infection control world, as well as like Instagram too. I mean, we do have a profile on Instagram. So it's interesting to see. I get laughs, I will say. Some of it is really creative and original, and some of it's really funny too, which I think is good too, because we need to have a little humor in this space in dentistry.
Yeah, for sure. You and I have like the most sexy topics, insurance and infection control. It's so sexy.
Exactly.
Like we're in such high demand. I know.
Yes, I know. I always tell people I don't have the most sexiest or most exciting topic. So it's okay.
Yeah.
Sometimes event organizers will say, sometimes people are, they might fall asleep. I apologize in advance. I said, oh, don't worry. I'm used to that.
Exactly. I hear you.
Yeah.
I hear you.
Yeah.
So let me ask you a question, because last time when we talked a lot about how there's got to be an OSHA person. There's got to be a point of contact. There's got to be somebody that owns that program. Well, infection control has really come a long way. I mean, OSAP has really exploded and done a good job at getting the message out there. And I will definitely put links to all of this information in the show notes. But what I've noticed is managers who kind of used to take it all on, now they're going, you know what? This is like bigger than me just maintaining a journal or a notebook. Are you starting to see it coming into its own position, its own set of responsibilities, rather than just kind of last person drawing the straws has to now take care of OSHA and HIPAA and all of that?
Yeah, I would say that that's definitely the trend. I am seeing a lot more dental settings, whether it be private practice, DSO, dental school, mobile dentistry. They are understanding that it's a team approach and that it can't just be all on one person. I think also people are getting the message that it's not, you can't just write things down in a notebook and then think that you're going to cover all the bases when it comes to compliance. Also, it's just a lot to do. And I just don't think that one person can handle it because they have the rest of their job that they need to do. And so I really am a big advocate of the team approach, having one person kind of lead the program just because that gives you some accountability, right? But definitely everybody taking a role and an active role in making sure that the office is compliant all the way around. So when you talk about like OSHA and HIPAA and infection control, there are duties for every single team member to do in the practice, whether they are administrative or whether they are clinical. There is a job that everybody can do. And if you spread the tasks out, then that means it's not all on one person. You reduce burnout. You kind of ensure that it's going to get done in a way, because just having one person trying to do everything, so many things fell through the cracks. But now people are understanding that we have to have more than one person involved. So that's a good thing. We're moving in the right direction there.
Yeah, I agree. I feel like a lot of managers are saying, let me hold on to HIPAA because that just makes sense to them. But they're kind of looking at infection control like they're just not familiar. They don't, maybe some of the admin don't take the courses that they should, or at least be familiar with how to turn over a room and all of that. So I feel like this is what I hear the most. I hold on to HIPAA, and then someone in the back, is going to take care of infection control. And like, I still hear from people when I bring up the fact that our last podcast, we talked about how OSHA is different than infection control because so many people wrap that all in. So for those of you, Yep. So for those of you who have not listened to the first episode, can you just do a quick overview of why they're different?
Yeah, sure. So OSHA focuses on employee safety, and that's information that's all about the physical space that your team is working in. It's also law. So OSHA is federal law, no matter what state you're in. In addition, there are some states that have a state plan, which basically puts more laws in place for your particular state wherever you practice. But again, the main mission of OSHA is to protect the employees. Infection control is really kind of guided by the CDC guidelines, and they are not a legal agency. They are an organization in the government. They make recommendations, but their whole mission is to protect the public. So that would mean their focus would be patient safety. Both of them overlap. There are definitely areas where they overlap, like PPE and record keeping and things like that. But for the most part, CDC infection control focuses on the patient protection, and then OSHA focuses on employee protection.
Now, your background as a hygienist really lent yourself to understanding this really well because you had to deal with this probably in your own practice. But let me hear the journey, though. Like, what made you go from RDH to infection control inspector? Because you're an inspector. Like, I just love saying that word.
I'm
Inspector India.
Yes, you're right. So I was, ever since I became a dental hygienist, for me, it was all about, following the rules, even when no one was looking. I was like that as a child. So it really came easy to me. I used to get on everybody's nerves at the office, but I just, from an ethical standpoint, I've just really held the ethical code of dental hygiene, dentistry, just really close to my heart. I've always kept it in my brain that, hey, this is a human being that I'm dealing with. This is someone's family member. I would want the same treatment if it were me or my family member. And so that's what's always kind of guided me into making sure that I'm doing the proper infection control protocols. But, as my career kind of developed, I wanted to go more part-time clinically and work outside of the operatory. And I began consulting, helping to build a dental hygiene program. And one of the owners of the practice asked me to reach out to someone in our community who was in charge of all the compliance, the OSHA infection control training for our, pretty much our state. And when I reached out to her, we began talking, and she just kind of opened up and shared that she was going to be retiring soon. And she asked me what was my end game. And sometimes when you're having conversations, they're buzzwords. And I've said this a million times. That's a buzzword for me, like end game. I'm like, So my antennas went up and I was like, okay, what are you talking about? And we began to just discuss like the importance of, making sure that her whole kind of all of her educational legacy continues because we need it. Right. And so I ended up kind of taking a few tips from her. I dove right in. I got connected with OSAP, which was one of the best things that I could have ever done. Organization for Safety, Asepsis, and Prevention. OSAP has just been really a godsend to me. They're such a great organization. They give you all of the resources and everything that you need. And that's where I got certified. And I connected with a lot of people in this space in dentistry, Dr. Shannon Mills and a few others that were actually on the committee for the CDC guidelines in 2003. And I just began to build my business. I went out into the community, started promoting every time, on social media. Hey, this is what I'm doing. This is what I'm doing. And just accumulated more education. And before I knew it, I had a business, and then COVID hit and everything just exploded. And so it's been nonstop ever since. So that's my journey. I've been in dentistry 28 years. And so lots of experience, lots of different patients, lots of different dental settings. And it's just become a real passion of mine. I'm just really excited for even what's to come, which is funny because people look at me weird. They're like, India, who gets excited over government rules and regulations? And I'm like, me.
Look who you're talking to. This is like the really weird, like excitable people crew over here.
Exactly.
But it's interesting though, the OSAP people that I talked to, and I worked real closely with Dale and Danby for a long time.
Yes.
Yeah, they're my goodness. I mean, the excitement, the passion, it's all over the place. And I love it. And that's what you want. You want someone that has that passion to go in and check your office out, because you may be thinking, infection control. So you want someone like you to go in there and be like, ooh, let me look at this. And ooh, let me look at this.
Yeah.
So being certified through OSAP, do you have to have a clinical degree, or are you seeing other people go through that type of same certification? Or,
well,
is that a career path?
Well, yeah, it can be. I mean, they have different types of certification. They have certification for clinicians. They have
Hmm.
certification for dental reps that work for dental companies that could potentially be
Oh,
delivering, some of the dental supply companies have their reps do lunch and learns and things like that. And
oh,
so some of them have been certified. And then they also have a certification for individuals that run infection control, like the education portion for a dental education company. So
hmm,
some of the bigger product companies in dentistry have someone that's in charge of their education where they provide CE courses or they sponsor different speakers. And so those individuals that would be the head of that particular department, there's a
hmm,
certification for them as well. And so we are seeing a lot more. We're seeing a lot more. I believe that it's going to become the standard in the industry, which I think that it should be, just
hmm.
based on my experience. And when you do go to social media and I get tagged in a question,
Yeah,
but I see like 50 other comments before I even get to the group, where some of the comments just are completely wrong. Some of
yeah.
them are even the recommendations are illegal, so I think, yeah, it makes me cringe sometimes, but
Hmm.
I think that this certification is becoming trend, and the
Good.
standard. They've partnered with Danby, which is amazing. And that is
Hmm.
their partner organization. And that's where you would go to take the test and exam. And so I think that it does wonders for this particular space. I think it's elevated dentistry. It's really
Yeah.
kind of put a stamp in dentistry that we're now starting to look at ourselves as healthcare providers, not just,
Hmm.
I love dental professionals. I love those two words, but we're more than just professional. We're healthcare providers. And
Absolutely.
so I think that it's just definitely kind of elevating us to catch up with our medical brothers and sisters for sure.
Well, on the medical side, in order to run like a facilities infection control program, you have to have like some
Yeah.
credentials behind you. Is that
Yeah.
correct?
Yeah,
Yeah.
absolutely. You
Okay.
have to have credentials. That is pretty standard on the medical side. And so just from the way that they run their clinics, from an infection control standpoint, their sterilization areas, just everything that they do, they have
Hmm.
much more regulation and oversight than we do. And so I think this certification is a step in the right direction.
Okay. Well, and it's always good to get yourself regulated before somebody comes in and regulates you for you. That's
Yes.
always
Yes,
like the rule,
exactly.
right?
Exactly.
So
Yeah.
now you mentioned DSOs earlier. Do you have a lot of experience in that space? Either the small DSOs or larger DSOs? Have you worked with many of those?
Yeah, so I focus mostly on the smaller DSOs. The larger DSOs tend to work with in-house
Hmm.
staff, and they have someone that actually does what I do in-house.
Okay.
But the smaller DSOs, they need a little bit more help sometimes. Some of them are startups, and so they're
Yeah.
trying to figure everything out. And so they
Right.
call someone like me to come in and help them get started and make sure. So yeah, I mean, I'm on the East Coast. I'm in the DC, Maryland, Virginia area. We have a huge kind of explosion in the Northern Virginia area of these smaller
Yes.
DSOs.
Yes.
And so that's where I'm starting to kind of have a lot of work with the smaller ones. Again, just because they don't have the in-house person, it's a lot.
Hmm.
It's a lot to do what I do
Yeah.
and how I help practices get started and get set up. There's a lot, and you got to have a lot of education and knowledge, really, and experience if you really want to make a solid program.
And you having the online, that really helps a lot too. I've noticed when I've gotten calls from emerging markets or small operations, they want to be able to train so many people, but there's only one of me, there's only one of you. I can't physically go to every office. And for you, I guess it's a little different because you're doing an actual inspection. I'm not, but it is hard to get all of them going kind of in the same direction. And so my hat's off to you with that. Yeah, Northern Virginia, it's amazing how much growth is going on
Yeah.
here. And you
Yeah.
would think that even in the Boston area like that, I was just talking to
Right.
somebody up there and it's pretty busy up there, but still even more going on and on. Like,
Yeah.
I don't know.
Yeah. Yeah.
We're
I don't know
coming up
what's
on
happening.
I don't either, but I'm like, okay, well, that's fine. We open up all
Yeah.
these practices, but can we find some people to work in it before you guys like keep
Yes.
opening? That's been a
Yes.
big issue. How
Yes.
has workforce shortages, how has that impacted the infection control in your offices?
It's really impacted in a negative way, unfortunately. I mean, you just don't have the bodies. You don't have the people there to be able to perform the protocols, these monthly protocols and these tasks that need to be done, these weekly tasks, because remember, on the clinical side, everybody that has an infection control or a safety, OSHA safety task to perform still has to perform the position that they got hired for, right? And that means assisting the doctor, or if you're a hygienist, you're seeing patients, or if you're an associate dentist, you're treating patients. So the staff shortage is negatively impacted, of course, this particular area. One of the kind of things that I've been really trying to push is the digital workflow solution, so that we could, like the digital tracking, to replace some of these manual tasks, because we still have to do them. We're still required to be compliant, right? And so that's been a little bit of a struggle, because in our industry, everybody is so used to doing everything manually, like manually writing down and tracking the spore testing, and manually writing down, waterline testing, like all of this. So trying to introduce a digital solution that might not necessarily be posted in your face on a cabinet door has been a pain point for me, because I'm trying to implement something that will make your life easier, but out of sight, out of mind many times, because we get so busy, right? And so that's been the struggle, but it's going there. Dentistry is going digital, and it's just going to be a matter of time to where everybody will adopt doing infection control tasks, the manual record keeping portion digitally.
So I'm glad you clarified that, because I was going to say, what on earth could we put into a digital workflow? So you're talking about like the spore testing, like maybe what else would be on there? Water lines.
You can track that. You can track, there is a guideline in the CDC where you are supposed to record the load number for every single cycle. There's a couple of different parameters that you have to record for every single time that autoclave is running. Wow. And one of the autoclave, brands, Midmark, they actually have a data log tracker. So it's a USB. Yeah, it's a USB. You just connect it. It's low cost. It's not, I think it runs, in the range between $800 to $900, but it completely replaces any one of the staff members writing each of these cycles and all of this information down. And so that's been really a lifesaver. Yeah.
What a no-brainer for that.
I know. Every time I walk into an office, and if they have a Midmark, and if it's a model, because it doesn't work with the older models, but I would say the last 5 to 7 years, those models it works with. I mean, people are jumping on it left and right, because they're still able to stay in compliance, but they don't have to have the manpower to do this, right? It's digital.
Well, I'm a little surprised by this, to be honest, because it's been a long time since I've taken in infection control. I'm not in the office as much and all. Yeah. So as an inspector, you going in, if you ask for that and it's not completed, that's a demerit, I guess. It's a bad mark,
that's
right?
A citation.
So
that
is that something that they are like, I didn't even know that was something? Yeah. Because I'm thinking, gosh, if I'm surprised.
Yeah, it's been in the guidelines since 2003, just like a lot of other things, right? And there's been updates, things like that on certain guidelines, right? But there's a lot that I walk into dental practices all the time, and they're like, oh my God, we never even knew. We thought we just had to spore test weekly. We didn't know. We thought we just had to put a date on the pouches. We didn't know that we have to track like every load, all the parameters on every load. And so there's a lot of different type of tasks that I see that practices just are unaware. And they're like, well, where do we get this information? What do we do? Of course that opens the door for the OSAP conversation, but that's very typical for me to walk in and that's not being done. And it absolutely they would be cited for that by an inspector if they didn't have that. All
right. Give me one other thing that nobody is aware of. Give me one other that you see that you are always writing people up for.
Let's see. Oh, I will say TB screening. No matter what the risk of the dental setting is, whether it's low risk, most private practices are low risk. If you're talking about hospital settings, things like that, community clinics, a little bit more high risk. But the
Okay.
guideline is no matter the risk, every single clinician or someone who has clinical duties has to have TB screening verification on file, or they have to sign a TB declination form saying they understand the risk, they're not going to get the screening, they know. And if in fact at a later date they want to do it, they'll go do it. So that a lot of people know about the hepatitis B vaccination, but it's
Yeah.
the
Yeah.
TB screening that a lot of people don't realize. And you are supposed to get that when you hire that team member. You're not supposed to
Hmm.
wait till after. Now, if you have not done it, the guideline is that if they've had a screening within the last 12 months, you can use that screening. And if they
Okay.
haven't, then they need to go get a screening or sign the form.
Wow.
Most offices that I walk into, they don't have it. So it's either,
Right.
we try to put a deadline in place and they get that. But yeah, that's a big one that a lot of people are like, what? I never heard about this. So yeah.
So for the people who are like brand new yesterday to dentistry, TB is tuberculosis. And
Right.
so if you don't have that, I mean, can you like do a group TB screening, like bring people in,
Sure.
or do they
Yeah,
all have
sure,
to
sure. Yeah.
go to the doctor?
No, no, no. Well, everyone is supposed to have an occupational health program in their practice, which basically
Hmm.
means that if anyone were to get injured in your practice, you have to have a facility for them to go to. You should have an established relationship with that facility. And that is where you could send your team to go get their TB screening. That's why it's important when you're choosing a medical care facility that they're able to do some of these types of procedures. I've walked into some offices that where they use maybe colleagues who are medical doctors and they're
Yeah.
family practitioners. And unfortunately, they can't do hepatitis B vaccinations. They can't do TB screenings. They can't do rapid HIV testing. So that's
Um,
why you need to call ahead, let them know, hey, we're going to be using you for our occupational health facility. Can you do hepatitis B vaccinations? Can you do stitches? Anything beyond basic first aid that we can do here in our dental office with our first aid kit and our medical emergency kit. What can you do? And
okay.
so typically I recommend a urgent care facility that can do
Uh,
like similar to like in our area, it's called patient first, but they're kind of like a quasi kind of emergency room, so to speak. So they can
hmm.
do a lot and you can use them as your primary care physician. But there are other urgent care facilities across the country that don't do as much. And so
Hmm.
that's why you need to call ahead and find out. I'm not a big fan of the emergency rooms at hospitals
Yeah.
because of wait times. But if
Yeah.
that's all that you have, that's what you have. And so that's what you have to
Well,
use.
so that would eliminate. So on social media, you hear, well, my assistant had a needle stick today. What do I do? So it avoids that. Like you already
Yeah.
would have had a
Yeah.
facility picked
Yes,
out.
yes,
Okay. And a
yes,
protocol.
yeah,
Well, I mean, I would
yes.
hope so, but just,
There was just a big to do on social media in one of the groups, and I got a private message. Hey, you need to check this out because I'm in the group. And there
ah,
were no screenshots. I just want to put that out there. Nobody broke the community rules. They didn't screenshot. They just said, hey, go check the group. There's a post in there. So I went and checked the group and that was the case. They were coming to the group. It was a team member. They didn't know what to do. And then there
mm,
was a doctor that didn't know what to do. And so if you have a program and a protocol in place, then there's no need for you to go to social media or ask anybody else
yeah.
what to do. And legally, you have to be careful with going to social media with all of this stuff.
Yeah.
You don't want to
Yeah.
put yourself in a situation where you're vulnerable. So I always tell all my clients, please call me, stay off of social media if you
No
forgot what I
kidding.
told you.
Yeah, because I mean, the risk. So, listeners, what she's talking about is you've got a doctor or a team member who's posting that there is no existing program.
Mm-hmm.
And that's not a good thing. I mean, that's
No.
basically proof of noncompliance. And
Yes.
maybe one of the other employees would be like, okay, now I'm at risk. I didn't even
Yes.
know. And that's an
Yeah.
OSHA complaint because it's
Yeah.
the safety of the employee, but it's also
Right.
infection control. What if a patient saw this and was like, what the heck's going on? And they
Yeah.
complained to the state about that. So
Yeah.
it's
Yeah.
risky.
Yeah, it is
Wow.
risky. It's a huge liability for practice owners and companies
Sure.
who own like a DSO. It's huge liability to not have these things in place. And it is one of the biggest reasons when a team member leaves and they are disgruntled for whatever reason, OSHA
Hmm.
seems to be the first office that they contact when they are disgruntled, even if it's about something that's administrative or they didn't like the
Yeah.
hours that they were given or whatever. I've worked with many doctors who end up getting an OSHA complaint. And the very first thing that they're told is that that OSHA is told, the OSHA office is told, is that they don't have a bloodborne pathogen standard in place.
Oh,
And
geez.
for employees who never knew, barely paid attention to the bloodborne pathogen standard training, all of a sudden they know that there's not they know there's not a
Yeah.
standard in place. So it's important. It's really important to
Yeah.
have that in place.
Yeah. Because even if the complaint stems from a really inauthentic place, they still
Exactly.
are they're still in big, big, it's a big deal.
Yeah, yeah,
You
and
don't, you
you're
don't want to
still going to get
see
the inspector
India.
showing up. No,
I was
the
going to
OSHA
say,
inspector is different from me. I'm the board inspector, but when the OSHA inspector comes, most states follow federal OSHA law,
hmm
and the fines are very high. They work a little bit differently. You get fined for every citation, not just a blanket fine like
goodness.
most dental boards. And, they're very thorough. They come in, they interview most of the time they'll interview every single they are very thorough. Not that dental boards aren't thorough, but it's just a little bit of a different style and type because they have different rules and regulations that they have to
For
adhere
sure.
to.
Oh,
And
God.
so it's not anything that you ever want to go through. Trust me.
So did you fix that person on social media? Did you give them the answers and give them the advice?
Well, I have to be careful sometimes because more and more people kind of know who I am and what I do now. Before it used to be a little bit easier, but I have to tread lightly with that. With this particular situation, it was basically, it's best if you just delete, this whole post should be
Yeah.
deleted just for
Yeah.
liability purposes because your name is there. Because what it morphed into was that there were some commenters that were thinking about reporting
Oh,
the
geez.
practice. And so I'm like,
Oh,
it's
geez.
best if so,
Yeah.
it got a little bit out of hand. And so that's why I always say, if you don't have a compliance consultant that you're connected with, talk to your colleagues first before going to these social media groups. See if they have
hmm
anybody that could kind of guide you. Of course, people reach out to me all the time that aren't clients. And so I'm sure you'll put my contact information in the show notes, but and I'm very open to guiding people in the right direction, whether they're my client or not. It's
Yeah.
social media just is not the place for it. It's too much liability as a practice owner. And even
Yeah.
just being licensed. I was never a practice owner, but as a licensed healthcare provider, I have to be careful to protect my license. So that's another reason why you don't want to put things on social media.
Just a reminder to check out the companies who support the show. My friends at Synergy Dental Partners are offering 2 free months to try out their lower prices for labs, supplies, and select software services. To sign up, visit odysseymgmt.com/synergy, and the link is also in the show notes. Yeah, I don't think people realize how many people lurk in these groups. I mean, just from
Oh
an
yeah.
insurance point of view, some of the really bad practices out there for insurance, the fraudulent billing practices, people very proudly talk about how they're doing it.
Yes.
And I used to, a long time ago, used to say, maybe you should delete this. Maybe. And I
Yeah.
don't anymore because it's so Wild West out there and
Yeah.
people are
Yeah.
very convinced that they're doing the right thing. But
Right.
the reason I bring that up is because I know the carriers. I know many people who work for the carriers and they're all in these groups. They're all in. And
Yeah.
if they're
Yeah.
looking for an office just to randomly circle
Yep.
and find to audit, you've just given them plenty of ammunition because they can
Yeah.
trace it all the way back to your office. And I've had some people say, I think I got audited because of something I posted. I'll
Oh,
go,
wow.
I
Yeah.
can't,
Yeah.
I can't prove it, but you know what? When you tell
Sure.
people that you're not billing for this and you're billing extra for that, well then, yeah, someone's going to audit you.
Exactly. And that's why,
It's
and
crazy.
when I'm talking about HIPAA, even with OSHA and infection control, I tell all of my clients, be mindful of your social media presence and what you're posting from the business Facebook and team members and things like that, and not allowing all of the visuals and the videos and the TikTok videos and all of this, because it is very common knowledge in my space as an inspector to know that state's attorneys, if your case ever goes there, they're immediately going to social media to try to find evidence that their case is credible, and they're trying to find supporting evidence. So the last thing you want is any type of video or any type of pictures with infection control breaches, with HIPAA breaches, OSHA violations. Like you don't
you
want
don't want
that.
like the slice of pizza next to the autoclave
Right,
while you're taking a
exactly.
break. Like
Right, exactly. And I'll tell you, one of the biggest ones is the non-compliance with PPE. I mean, it's so egregious, some of the videos and the pictures that I see, and I'm
please
thinking,
expand on that, because I'm the same way. I look and I'm just like, oh my gosh, don't post that. You're just, it's disgusting, first of all. But
I mean,
so
and I
get
know
into
that
that,
people
please.
are trying to promote like their friendly dentist because of the stigma, the societal stigma of like us, going to the dentist, it hurts and it's terrible and it's sterile and you don't want to go there. So I get it. I know you're trying to make it like a fun family atmosphere, and it's nice to go to the dentist and it's great and things like that. But the problem is, many times nobody's wearing proper PPE. Patients don't have safety glasses on. There's some sterilization breaches and things like that I see. And I know you're trying to promote your business. I know you're trying to market. I get it. You're working with companies that want you to do certain things, but you need to draw a line and say, hey, these are our boundaries. We can do XYZ, but this we really can't do. I would even say on the HIPAA side, it's bad as well, because so many offices post and they don't get those written release forms signed, by the patients, and they're posting, the patients are in the TikTok with them, or the, whatever the case, or the video on Instagram, or just in the picture, and they're just promoting, the dentist wants to promote and mark the different types of procedures, the before and afters and all that kind of stuff.
Sure.
So a lot of offices do great with this, but then there's a lot of offices that maybe they just don't know. And so I don't want to say that people don't care. I want to be like, no, they just don't know, India, because some of the stuff that I see, I'm like, they just can't know. Because if they knew, they totally wouldn't do this.
Well, and I think too, you have people who grew up in front of a camera. Like you got babies at cheese automatically in front of a camera. So they're thinking, why do I need to sign a release? But for people of our age who have been coming up for a while, we remember when this was a big deal and you had to get a release for every medic case that you took, before and afters, and then social media came along. So for those of you who are listening, and this is the first time you've heard it, it is a thing that if you take a patient's image or likeness and their personal, I guess, even their x-rays, although some people have told me you don't really need it for x-rays because it's not identifiable, but I don't want to mess around. So I would rather just, why create all these exceptions? Just do it across the board. If you think you're going to be using it in any kind of media, then you need a release form. And that is found in, I think, your HIPAA manual, right? Isn't there a form in there?
Yeah.
So just use it.
It's in the HIPAA law. Yeah. It's in there. You have to have what they say to do, what is the best practices are as far as HIPAA goes. If you are a doctor that wants to do like your before and after, or let's say you lecture and you're training, the industry and people in your community in the industry, the least amount of identifying, I guess, pieces of information as possible. So just close-ups of the mouth, right? Before and after, something like that. Try not to do a wide shot unless it's absolutely necessary to get your point across with whatever you're trying to do. There are a lot of dental practices that are getting in trouble. HIPAA is just like exploding. I mean, the complaints, the OCR, which is the Office of Civil Rights, they've had more investigators, since the new administration came in, and many complaints. I mean, many complaints on healthcare facilities, dentists.
But it's like shooting fish in a barrel, though. Like it's like you pretty much investigate and you're getting paid. From everybody that I know that's ever gone through a HIPAA audit or a HIPAA investigation, none of them have passed, even if they thought they had a really good, program.
And none of them got away without paying a fine. I can tell you that everybody pays a HIPAA fine. Like I'm here to tell you, everybody pays. And so they are like OSHA, like their fines are hefty. And so it is not, and to go through a HIPAA audit it's like 25 pages of like just all these questions. And each question you need like 16, 17, 20 pages, worth of documentation of things that you've been doing. So you just want to avoid that altogether. And so that is why the name of my company is called Learn to Prevent, because the whole purpose of it is learn how to prevent all of these inspections and all of that. So, and it's always when you least expect it.
Of course. And one horror story I had, you're just going to, because the implications, you'll understand this. There was a HIPAA audit. Actually, it was a patient that wanted their records and they weren't able to get it. It was a miscommunication, but it was just a disaster, like all around, right? So they were going through an audit, and the manager for this poor young dentist, the manager just said, I'm out. I'm not complying with this. And so the dentist had to do everything, and she was freaking out. I sent her to her state association because they had a resource for this, but it was what basically happened was the manager looked at the documentation that had to go through it, and she said, I don't get paid enough for this. And she just quit. And that was, because that's what I hear. It's like, really, it's onerous. So to be clear with the image release form, is it per occurrence, or you can't just do one blanket, like for that patient as part of their new patient paperwork? Like, is it, or can you do that?
Well, I would say it's best to do, it's not written in the law as just a blanket release. And so certainly it's recommended, because of the way it's written, it's recommended that you should have one per event.
Okay. Well, that's good.
Yeah,
actually,
event, right?
As long as we know, so we can make that as part of their returning paperwork. Maybe there's just a line in there that adds it for the crazy social media, like good, crazy, posters, make yourself,
You can certainly,
yourself.
You can certainly do that. You also want to make sure that you have some type of records, a waiver for, not records release, but a waiver for your team members, because you have some team members that don't want to be on social media and posted and everything. So if you're going to post them, you want to make sure that you have them sign a waiver as well, because everybody's great in love in the beginning, but if the relationship, but towards the end, when you're about to break up and they don't want to be there anymore, you don't want them to come back and say, well, I never gave you permission. And so I always tell all my offices, if you guys are heavily involved, or even a little bit involved, and do you post? Like, what do you post? That's one of the main questions that we discussed during HIPAA. What do you post? And some people will say, well, it's just the generic marketing posts that our marketing company. Some people are like, oh, we just do staff. Okay, well, everybody needs to sign a release form for that.
Is it revocable? Is it revocable though? Like,
sure, absolutely.
Okay.
If they say,
because I'm thinking,
I don't want to be posted anymore. Please, things happen. On social media now, people are stalked and, different hacked and different things like that. And if you don't want your image out there, you have a right. That's your right. And you just have to, what I recommend to all team members who want to revoke their waiver, you just put something in writing stating, or you, as the office practice manager, could just have a form that you create and have them sign. And then you make it a blanket rule. Do not put this person in any type of advertising or marketing or videos or anything like that. Yeah.
Well, and that person probably would just have a grumpy face anyways, like wouldn't want to be out there.
Exactly.
So all of this would be, so I know you have your modules, but what I was really, so I'm excited about that. And I want to hear a little bit more, but what I was really excited about was that you have an onboarding special. And that, for busy managers that I talk to all the time, they're like, I think I need to do this and I think I need to do that. But you've solved that with an onboarding program. Can you go into what that's about?
Yeah, so it's an on-demand, self-paced training through our learning module, which can be accessed via our website under the e-learning tab. And it's specifically for new hires. It's your HIPAA training, your OSHA training, and infection control training. We have it set up to where once they have completed it, they're given instructions, the new hires given instructions on, making sure that they download the completion certificates and they send them to the practice manager or the practice owner, whoever is in charge of receiving that HR paperwork. And what that does is it helps the practice owner or practice manager to stay in compliance with that 10-day rule for OSHA. Now, HIPAA and infection control, there's not really that written rule. However, from a, liability standpoint, risk management standpoint, it makes sense to have them trained right at the beginning on these particular topics. And there's been plenty of studies. There was one study I was looking at where employee retention is increased if you train your new hires. And so with the staff shortages happening, right? With all the staff shortages happening, this is kind of a feather in your cap if you can make sure that your team members are trained before they start working. I typically recommend that this absolutely should be done before they go on the floor. Whether they're administrative or whether they're clinical, they need to be trained. It also allows you to continue and strengthen your infection control program. And it sends the message to the new hire, hey, we know you have a lot of experience. We know you've worked in many other offices, but in this office, this is how we do it. And this is what we're going to do. So it allows you just to reiterate what your kind of program looks like in your practice, how you guys handle your infection control program, how you guys handle HIPAA. And then what it does is it opens the door for you as the practice manager to have that kind of post-training conversation, which should be, do you have any questions? Okay, great. No questions. Let's take you on a tour around the office. Let's show you where everything is for HIPAA, infection control, OSHA, all of that. And it just really reduces the amount of man hours that you as the practice owner need to spend in this particular area. We kind of do all of the heavy lifting. And then all you have to do is come at the end and just answer questions if there are any. Take your new hire on a tour and they're ready to go on the floor for you. Yeah.
I think that's phenomenal. As a manager, it was hard enough herding cats to get everybody together for their annual, training. And then inevitably I would lose a team member or add a team member like 2 or 3 weeks or a month after that training. And I would be like, oh my God, because now it's on me to do all of that again. So to have a program, I would have been all over this. So for those managers who are just like, oh my gosh, another employee, yay, but oh no, here we go again. You definitely want to check that section out. It's interesting that you say, it's so important that they see the training. I've talked to a couple malpractice attorneys who are like, I really wish with any new employee, they just wouldn't let them touch any patient before they took this type of training, but we're so concerned with throwing them right in there because we're short, but the liability is pretty big. It's huge. And it's licenses on the line and that sort of thing. So I'm glad that you have a solution for that. So tell me about the other parts of the e-learning that you're going to have available. I believe it's going to be in October. Everything's going to be ready to rock and roll, right?
October 2nd, it launches that Monday. So we've had it in the past, but we've just kind of revamped it. We've updated it. And basically it's a full infection prevention OSHA HIPAA compliance program that you can implement on your own. And all the practices that have taken it in the past, they think it's phenomenal. They think it's great. You get all of the instructions, literally, like we hold your hand through the whole entire thing. It's not just a bunch of videos where we say, hey, go take the videos. We tell you how to use the videos, how to conduct the trainings. If you're going to do team training, individual, like we really try to hold your hand because what we found is this information can be so overwhelming. It's almost like analysis paralysis. And so what we try to do is give you the steps to make sure that not only you take the training, but how to implement it, but also how to implement the training in the practice. Because some people are like, well, what do I do? These are these videos. Do I just sit people in front of the computer and walk away? And then you don't even know if anybody learned anything. So it's been really good. We have all of the record keeping documents that you need for compliance for each topic area. We've also added, we give 2 bonuses with we call it the DIY, do it yourself, safety made simple, but we've given you medical emergency preparedness training. And then we've also given you abuse awareness training. And so those can be for those team members that need that for their license renewal and all of that, they can, take those courses as well. And all of it comes with continuing education credits. So everything gets a CE credit. AGD PACE provider.
Yeah.
So it's been really great.
I love seeing that you've included the abuse and the neglect and awareness package. I mean, I think that's so important. Even if you don't need it for licensure, people who have listened to my podcast, they know that it's a serious issue in our industry, and we're perfectly poised to help out with identifying that. So I'm glad that you have that. So what if somebody needs a little bit more? Like, what if they're like, okay, this is great and all, but I think I need India. So what's going on there? How do they get in touch with you?
Yeah. So right on our website, you just go to the Get Started page, and depending on what your option is, you're going to just book a discovery call, and we're going to have a consult. We're going to have a small chat about where you are, what's going on, what do you need help with, what type of support, what level of support do you need? Because the biggest thing is you can have access to all these tools, but you're just not sure how to implement them. You don't know what the next step should be. And so, that's how you can reach us on our Get Started page on Learn to Prevent.
Awesome. Wow. You've got a lot going on since last time I talked to you. This is great. I'm really excited to hear about it. So, what's the one crazy story? Cause I always love the horror stories. And I said to you in the beginning, do you have a horror story for me? So tell me your horror story before we wind things down.
I think one of the horror stories was there was an office that did not have any biohazard boxes or anything in the office. And I was like, what is
no sharps containers, nothing?
Only one that was being reused, and it was being dumped and reused. So I'm
Seriously?
like, where are we dumping everything? So I'm like, oh my God, if I had pearls, I'd probably be clutching my pearl. I would clutch my pearls, but I was like, oh my God, I had to like walk away to get myself together to come back to be like, did I just hear it? Like, no, because I'm looking all over the office because I'm doing like a mock inspection, and I'm like, what is going on? Like, where is everything? Because maybe I didn't look in the closet correctly. Maybe it's up on a shelf and nowhere to be found. No. So there was just things were being put in regular trash.
And
so
oh
no.
This is an aside, but whenever I watch like Law and Order and they always have to jump into the dumpster to go look for things, I'm always ew, no. Because I imagine like, well, not besides everything else, but like, I know dentists or I know offices that just throw that stuff out. I had one person tell me, this is years and years ago, she was like, oh, we just whip up a bunch of alginate and pour it around. And I'm like, wow.
Well, that stems from the old school dentistry, 20, 25 years ago, where you had that product that you could buy and you would just pour it into, and it would become like cement, and you just throw the whole thing out, and so you would throw it out in regular trash. But unfortunately, the alginate is not cement, and so it doesn't work like that,
No. And they're like, well, it's cheaper than stone. And I was like, it doesn't matter.
Right. I know. So I even heard a story the other day. A dentist was washing his gloves, and he had a clothesline that was hung in the sterilization area, and he was drying his gloves. So
stop.
I'm just like, oh, that's so yummy.
That's awful. Like, but don't you wish you had a picture? Like you wish you had that picture for your classes.
I do. Well, it's funny you say that. I just finished a training earlier this week, and I couldn't help myself. And I'm sitting in my truck, and I'm about to leave, and I came out of the building. It was a business building, and they have multiple dental offices in there. And I came out of my client's office, but I see a dentist from one of the other offices who I don't know. They're not my client. And he's in full on PPE going to the mailbox, and he's getting his mail. And I couldn't help myself. I took a picture, and I have it. I have a smiley face over his face. There's no way. There's no identifying. There's no address. You can't tell. But I'm so putting that in a presentation because I'm like, this can't be real. Like, this can't be real. I mean, what are the odds of an infection control trainer sitting in her vehicle, and she lifts up her head and it looks, and there is somebody in full on PPE. So I'm totally putting that in my presentation.
That dude probably went to Panera in the full getup to get himself some lunch,
Oh my gosh, you're right. Every time I see that, I'm like, oof. When I see that, I'm like, take off that jacket, stop walking outside. But yes.
Oh,
exactly.
and for years, I never really thought about that because we did that until we took a class. And then I was like, now I'm like, oh, that is so disgusting. I think of all the places I took like crown buildup and crown removal vapors with me.
Exactly. Not to mention all the environmental stuff that is now on you. And then you're bringing it back into the operatory with your patients with their mouths wide open. I'm like, oh, that's not good.
See why the world needs you and people like you. So one last plug, India, tell them your website again and what your speaking topics are so they can find you.
Sure. So my website is www.learntoprevent.com. That's LEARN, 2, prevent.com. And you can find us on social media. We're at Learn to Prevent on all of the platforms. And my speaking topics, I provide infection prevention or infection control, OSHA, HIPAA, abuse awareness, and medical emergency preparedness.
Wow, all of the fun stuff. But seriously, like people, as you can tell, she's going to keep you awake. So you'll be fine in these classes. I know with the 2 I's, infection control and insurance, like people think it's just going to mean like zzz, and it's not. It's fine. We entertain. So we aim to please.
We do.
Well, thank you for coming back, and you are always welcome back anytime. And so I will have all of the information for India on the bottom on the show notes. It'll always be there for you so you can check her out. And thanks again for being here. Appreciate it. Dear listeners, as always, I so appreciate that you spend your time with me.
We're all super busy, so thank you for making time for me today. The show notes will have any links that we referenced in the episode. You can also find links for my book, events, and my online insurance course, Dental Insurance Design and Management. I speak often around the country on management and insurance issues. Come hang out with me in one of my classes. I promise you'll laugh and learn.